PharmaPoint is the leading provider of medication optimization across the care continuum. Our value proposition is helping providers target specific high-risk patient population to drive their medication optimization. We do this by utilizing our software platform, XchangePoint. So obviously there is a category of high-risk patients that are participants in the opioid epidemic. Americans represent less than 5% of the world's population, but they consume 80% of the world's opioids. Opioid-related deaths tripled from 2000 to 2014. Opioids were involved in more than 42,000 deaths in the U.S. in 2016, with prescription opioids accounting for about 40% of these fatalities. Healthcare providers want to help these patients. They need information, they need critical alerts in real time so they can proactively help these patients. That's what we provide via XchangePoint. First of all, medication reconciliation is vital for any and all patients. It is the starting point to drive better quality of care, and it is critical for patient safety. It has been long named a national patient safety goal by the Joint Commission, and up to 70% of hospital readmissions are a direct result of problems related to medication errors and adherence. Now, as it relates to opioids, we know that a significant number of patients have been prescribed opioids to treat chronic pain. And over the years, there has been an increase in overprescribing. A very thorough medication reconciliation can alert the care team right away to any red flags regarding the patient's misuse or signs of addiction. With XchangePoint, members of the care team are able to see this data right in front of them, real time, that shows a patient's medication history and alerts them of any risk. New risk management features within XchangePoint give care team members the ability to highlight patients currently taking opioids and pull specific reports in order to see high-risk patterns. We use multiple Physician Quality Alliance standards in our algorithms to make sure we are addressing all of the proper high-risk metrics. For example, more than 30% of overdoses involving opioids also involve benzos. So XchangePoint's reporting features provide the ability to flag those patients that are using both opioids and benzos and provide an alert to the care team of this risk so that they can proactively address it. Another great risk management feature is the creation of a separate therapeutic class for opioids that will show up on the patient's medication scorecard in XchangePoint. These medications are highlighted in red, alerting care team members that this patient is taking opioids. If there is a non-cancer patient on multiple opioids, it is a critical red flag for the care team to proactively address. So we are enabling that care team in identifying high-risk patients in real time so that they have the capability to proactively address this with the patient before it's too late. Our MedIndex adherence scorecard is constantly updated with new Pharmacy Quality Alliance measures. Users have the ability to pull target patient medication reports real time so they can see all of their high-risk patients using opioids at any time. As discussed earlier, they can pull a specific report for all their patients that are concurrently taking opioids and benzos. Then they have the ability to click on a specific patient and understand their medication and medical history. With this information, they can now proactively care for this high-risk patient. These patients are no longer falling through the cracks or hiding in the shadows. With this valuable information provided by XchangePoint, we can now prevent these patients from abusing their medications and treat them for the best possible outcome.